So at the end of her intake session, I always like to at least give somebody something to walk out the door with that can be useful to them. And when I work with trauma survivors, really, I think the most basic of coping skills that can be useful are what I call grounding skills. And you can find grounding skills described in different models, dialectical behavior therapy, and other, especially trauma-focused treatments. My favorite sort of list and categorization of grounding skills comes from Lisa Najavit's Seeking Safety. And in that treatment model, there are three basic categories of grounding skills that we teach. The first one is physical grounding. So a lot of times this can be the most sort of fundamental level of grounding skills, because when somebody is caught up in their head, in their mind, in their emotions, one way to bring them back to the present moment is through physical sensations and the current physical environment. And so physical grounding skills might be something like, if the person is sitting in a chair that has arms on it, just gripping the arms of the chair and noticing the sensation of holding the arms of the chair and feeling what that feels like, identifying all the places where your fingers are touching the chair, etc. Another one would be digging your feet, digging your heels into the ground and noticing that sensation. Again, you're doing something that is not harmful, but you're providing a little bit of pressure, a little bit of physical pressure to be able to bring that attention to that physical sensation. You can also sort of imagine feeling the gravity. You're sitting in a chair, for example, and just feeling the gravity holding your body in the chair, feeling gravity holding your feet to the ground. Or another physical grounding skill might be feeling a comforting object. So that could be whatever works for that person, whether it's something soft, whether it's a smooth rock that they carry around, whether it's running their hands under warm water, etc. Any of those things can be considered physical grounding. The second category is mental grounding. Mental grounding is trying to focus your mind on something different than whatever is triggering your mind. And that's like by purposefully putting your mental attention on something else. So one thing might be describing your environment in detail. So I'm sitting in a room right now with purple walls and wooden accents around the walls. There are 7 paintings on the wall, on and on and on. So like in the most minute detail to describe what's in the current environment. Again, if the person is being taken off into an imaginary or historical scenario in their mind, you're bringing them into the current environment by just non-judgmentally describing what's around them. Another thing you can do is categories. So like come up with every type of dog that you can think of, or name every band that starts with the letter A. So just something to purposefully turn the mind to something else, or describing an everyday task in great detail, like brushing your teeth or starting your car. And then the third one is soothing grounding. That might be having a favorite song that you have ready to go in your favorites on your phone, or picturing people that you care about, saying a coping statement that reminds the person that they're safe and that they're strong. Whatever. So I went over with her those 3 categories of grounding skills and talked about using those over the next week when she started to feel anxious and needed to take a moment to take a step back from that. She also said that she had a relaxation app on her phone that she had used previously, but not lately. She said that sometimes doing the relaxation ended up making her more anxious. So we both agreed that could be good to try if she wanted to. She could do it as an experiment, but it was up to her. But I did suggest that from now on, when she did the relaxation on her app, that she do it with her eyes open. So a lot of times we see that with trauma survivors, doing exercises with their eyes closed can actually be triggering for them, just from a safety perspective, especially if you have somebody who's been in an uncontrollable situation or where they felt unsafe specifically. So teaching them that they have control over keeping their eyes open. I just encourage people to look down, maybe let their eyes unfocus, looking at something non-specific, so that they're not distracted by what they're looking at, but they don't have to be keeping their eyes either wide open or closed. I also want to say a note here about the role of purposeful distraction. So I talked earlier about the problem oftentimes with experiential avoidance by things that people do to get themselves out of contact with the present moment. Well, so some people might suggest that these grounding skills that I've just described are themselves a way of promoting avoidance, right? Aren't I sort of teaching the person to not focus on their, say, PTSD symptoms or anxiety, and instead I'm having them focus on another sensation or thought or feeling? Well, yes, in some ways that's true. And so I try to point that out in a very concrete way to the client. I may even sometimes specifically say, like, and over time, I suggest that we may work on reducing your avoidance, because I have a hunch that avoidance is one of the things that is creating and maintaining problems for you. And at the same time, my immediate goal is that when you are triggered or feeling highly upset, that you're able to get through the moment without doing something that makes the situation worse. So what I want to work on practicing with you is, what are some things that you can do to help you get through that moment? Over time, we may work on having ways of doing that that are more focused on other alternatives to avoidance. But for right now, I would way rather you use listening to your favorite song or running your hands under warm water as an adaptive form of avoidance, rather than focusing on, oh, all avoidance is bad. It's not the case that all avoidance is bad, but using avoidance on autopilot rather than mindfully can be problematic.